Hello and welcome to Aging on the Suncoast. I am Regina Novak, Director of Outreach for the Area Agency on Aging for Pasco and Pinellas County. We are excited to bring you today's episode on aging and caregiving. The Older Americans Act, also known as OAA, is a federal law passed in 1965 that promotes the well-being of Americans over 60 through elder care services and advocacy programs designed to meet their specific needs. The goals of OAA programs are to improve older individuals' quality of life, preserve their independence, and prevent or delay the need for costlier institutional care. These goals are achieved through the implementation of a comprehensive and coordinated service system that provides a continuum of service alternatives. OAA Title 3E and 3EG are focused on caregiver support services. We know this is a topic that is near and dear to so many. Most of us, at some point in our life, will be a caregiver. While each of us will have our own experience and circumstances, caregiving is a big job. It has its challenges and its blessings. It can be a time of joy as well as a time of sadness. We also know that caregiving can also be a season of life when we feel alone, like no one else can understand what life looks like or how we feel. There's no definite roadmap on what this journey will entail, but our goal today is to bring you hope, remind you you're not alone, and that no matter the journey that lies ahead, there are people and agencies who are committed to helping you and your care partner along the way. I am absolutely delighted to welcome two very special guests, Terri Toner and Jane Swank, to have this conversation with me today. Terri's interest in serving older adults and caregivers started with working in the assisted living environment. She then transitioned into teaching healthcare prevention classes for seniors through local health clubs and community centers. From there, Terri moved on to CARES, Community Aging and Retirement Services, where she taught the fall prevention class called A Matter of Balance. This then led to her employment with the Area Agency on Aging as the Health and Wellness Coordinator, where she oversees the evidence-based programs called Savvy Caregiver, A Matter of Balance, Chronic Disease Self-Management, Chronic Pain Self-Management, and Diabetes Self-Management programs. Terri brings over 25 years of experience in delivering healthcare preventive services to individuals and communities. Her passion and foresight towards preventive care makes her a true ambassador and advocate for senior healthcare and prevention services. After working with her for several months now, I can attest to the fact that her heart is truly in the work she does. I also want to introduce you to Jane Swank. Jane wears a lot of hats in her life, including the fact that she is a caregiver and has completed the Savvy Caregiver program. Jane's professional experience includes over 30 years in the healthcare industry, serving in director-level positions in large medical facilities. She has traveled the U.S. extensively in an RV, where not only did she see our beautiful country, but she took up art training that led her to become an award-winning artist. Jane is part of the Creative Artists Guild of Dunedin and the Pinellas Park Art Society. She teaches watercolor and alcohol ink art classes, and her art can be found on display in several places around the Tampa Bay area, including Oldsmar and Pinellas Park City Hall and the Largo Library. Jane has also served as president of the Women's Club at Mainland Senior Community. I am humbled and honored to get to spend time with these two rock stars today, so I want to give a warm welcome to Terri and Jane. Thank you.
Thank you, Regina.
I can't believe I get to sit on stage with the two of you ladies. This is a wonderful, wonderful time, so thank you.
Thank you.
You're welcome.
So, caregiving, near and dear to our heart. And, when we talk about caregiving, we talk about at least two people. There are definitely more than two people in that caregiving scenario. But when we really kind of think about that, let's consider there's a caregiver, right? And then there's the care partner. Oftentimes, we see that the caregiver ends up some sacrificial type things where there's a lack of self-care because of taking charge of that other person. Terri, you have extensive experience in this. Can you walk us through the roles of care partner and caregiver and what you've kind of seen in those situations?
Yeah, so the care partner is the person who seeks to have a safe and secure and a calm environment. And as well, that person needs to feel like they have meaningful engagement into any activities or tasks that they're doing. The caregiver is typically the person who is providing that engagement, that meaningful engagement, which we call in the Savvy Caregiver program contented involvement. Mm-hmm. Now, in the caregiver providing that contented involvement or meaningful engagement, he or she takes on many different roles, anywhere from being a healthcare advocate to an activities director, a social worker, a family diplomat, a companion. And with all those many roles, yes, self-care can be sacrificed. So we definitely have the Savvy Caregiver program that will help in teaching how to be able to have contented involvement for that care partner, and then it is reciprocal to the caregiver, as well as being able to gain resources. That's very important to help them in the journey.
Absolutely. And we are going to talk about self-care a little bit later. You mentioned Savvy Caregiver, so I want to hear about that class. And I'm going to bring you in on this conversation as well, Jane, since you are a graduate of the Savvy Caregiver class. So Terri, I do want to start with you first. First, who is eligible to participate in this program? And can you give us sort of a brief overview of some of the tools, some of the highlights that, if I'm a caregiver, I could expect to learn in this class?
Yes, absolutely. So the eligibility is for a caregiver who is taking care of anyone who has any kind of memory loss or dementia-related disorder. Now, it does not have to be an official diagnosis, but their caregiving is related in some way to that memory loss. The person that they're taking care of has to be living at home and at least age 60. So those are the credentials to be able to participate in the course. And the highlights, there are so many. The first thing that we like to teach everyone is to understand all of the different dementia-related disorders and Alzheimer's. What are the different changes that are going to occur, or the stages of change that are going to occur through the process of that dementia-related disorder? How to be able to match a person's remaining skills and strengths to where they are in that disorder. And then also really important with those tasks is to be able to understand how much they might have to break down that task that the care partner is able to be engaged in. The other thing is sometimes there's very difficult decisions that need to be made. So we actually have a quite sophisticated tool that is easy enough to use to help in the process of making a hard decision that a person can't figure out. And then finally, the resources that can be available. There's a great aspect of the course that we are sharing with one another, right? We are applying the tools. It is live because you're taking care of the person. So we're sharing the tools that we learn and finding out what worked, what didn't work. So we gain a lot of insight that way. And then, of course, with the different resources that we supply in the program, to be able to also balance that with the importance of self-care for the caregiver.
You create like a network of people, like there's solidarity in that, in what you just described. I love that, bringing that community together, because we said before, people feel alone. They're not alone.
Exactly. And that's what we love about the class, the fact that you're gaining tools, you're able to apply them. Our teachers ask you the next time, how did it go? Did it work? What didn't work? What were your successes? Did anybody else have that same type of situation that they encountered the same thing? So the aspect of feeling alone is greatly diminished by participating in this program.
I love it. And Jane, you took the class.
I did.
You're a graduate. Can you share, based on what Terri gave us on some of those highlights, can you share a little bit about your experience, maybe 1 to 2 things that really stood out to you and resonated with you with your care partner?
With my care partner, yes. One of the things we focused on initially was she was focused on her prescriptions. And so I designed a spreadsheet so that she could see what drugs she was taking, the amount, and how many times a day. And then she looked at the sheet the next time I came, and she wanted to know who the doctor was. And then the next time I came, she wanted to know what was the purpose, why am I taking this drug? And so I designed a sheet so that she could carry in her purse and one for her refrigerator, which happens to disappear every time I go to her apartment. But those are the things that happens. Sometimes they hide things. Like I found her computer in her dresser drawer, and initially her prescriptions were in disarray. Now I have a locked alarm box for her prescriptions, and a time is set. When the timer goes off, the mechanism turns, and she has access to the AM pill or the PM pill. So that's working really well. So there's different things out there that you can do. For those who have peripheral neuropathy, because sometimes they lose the sensation in their hands and feet. She was having difficulty holding a spoon, so I went to the dollar store and got hair rollers. Everybody should be familiar with these $1 pink foam rollers, and it has a little tab that goes over it. I put it on the spoon, so now she can grasp the spoon easily. You can put a pen in there. You can put a pencil, different tools that they may require, and it makes it easier for them. So these are the kind of things that we share with the class, so that now I offer to make spreadsheets for whoever would like, and maybe I'll make a blank one for the Savvy Caregiver class teachers, and they can, give it as a sample or have it as part of their packet. But those are things that are important for the patient and for the caregiver, because it helps me keep track of what's going on.
And that's to the point of providing a safe environment, right?
Correct.
With that medication management and security.
Yes.
That, you feel secure, you can actually grab onto something. So those are really nifty ideas.
Yeah, thank you.
Well, and again, you create that community where there's the class curriculum, but then you have the ability to connect. I mean, it's almost like a extended family that's able to work together. And I just love that. I mean, again, you are not alone.
That's right.
You have other people. And I think the next question is probably something I imagine most caregivers, that's a lot of people in our audience that's going to be watching this. What do I do with my care partner? So, Terri, I'm going to have Jane go first on this, because I know you've got a lot of information about the class, but when we think about activities to do with your care partner, are there like one or two things that you found the two of you really enjoyed? Maybe something social, maybe an intellectual activity that really was a good way for you all to connect?
Yes, at her birthday party that we had, we brought in albums from her past and went over who the people were in the pictures. So the older the picture, the more she could relate. The short-term memory is the biggest problem. She can get in the car and ask 10 times, where are we going? Why are we going there? And you repeat, and you repeat. And some of the main things are your tone. You can't frown. You need to. I walk in a jolly manner. I try to tell her some kind of funny situation to get her in an up mood to start with, and then proceed. She plays cards. She plays bridge very well. She cannot do something like triominoes because that's a newer game. That's a tile game, and it has numbers on it, and it's a challenging game at times. So we don't do that. You focus on what they're able to do. So hand and foot she's able to do. So it's kind of a fun activity for her.
I love that. And Terri, I know, when we've spoken, we're going to go to break here in a minute, that it's about finding things that they enjoy.
Right. So as Jane's example pointed to, it is being able to tap into things that they enjoy. their interests, tapping into their interests, tapping into their likes, tapping into memories that have been from the past that they can relate to. Any kind of engagement, that meaningful engagement, that's what we're talking about here.
Yes.
And in doing so, again, that meaningful engagement will translate to make you, the caregiver, happy. So that's very, very important.
I love that. And we're gonna take a short break here. Don't go anywhere. I want to thank Jane for joining us here today, for all you do to spread the word about Savvy Caregiver, for being part of that class. And when we return, Terri and I will discuss the very important topic of self-care for caregivers, as well as talk about the different stages of caregiving. So stay tuned for more.
For people with diabetes who refuse a shingle vaccine, I talk about the importance of receiving the shingles vaccine. I talk a lot about what the experience is having shingles, and a lot of times they'll also tell me about somebody they know who had shingles. And so we talk a lot about the importance of preventing shingles, the pain associated with shingles, and then the duration of having shingles once you actually experience that. So when we talk about a couple of examples like that, people usually feel better about starting the shingles series.
When there's a hurricane coming, do you know your evacuation zone? Evacuations are called based on the threat of storm surge. Look up your address to know when to stay and when to go. Know your zone. Visit our website at disaster.pinellas.gov or download the Ready Pinellas app. Be prepared this hurricane season. Know your zone.
Welcome back to Aging on the Suncoast. So Terri, I want to get into self-care because this is such a difficult conversation. We live in a society where this idea of taking care of ourselves is selfish, right? We know self-care is essential. We are worth investing in. What does self-care look like?
Well, before I even go into what it looks like, it's how do you even make time to have self-care? So if we can look at the graphic that is presented before the audience today, you're looking at, to be able to have self-care, that you have to have a support system. It's really important, and it's on, with that support system, how you can strengthen those relationships. So in the graphic, you're going to see different arrows, and the arrows that are thicker are the ones that are relationships you have that are very strong, and they're pointing toward you, so they're helping. Then you're going to see the arrows that are less thick, and those might be relationships that are a little bit more casual, maybe not as frequent, to help you in the caregiving. And then you're going to see the arrow that is disjointed and it has dots, and that's moving away from you. So that's actually depleting your ability to be able to function. So you have a decision right there. Number one, can you go ahead and reinforce that person to be able to help you in the caregiving? Can you give them specifics to help them? Are you getting feedback from that person on what worked, what didn't work? And if you are supplying that and you feel that the relationship is just not working with your care partner, then that's something that's depleting you and is going to sabotage your self-care. So along with strengthening those relationships, you also have to have professional resources, and that's the other graphic that you're going to see, is what other professional resources, just to give you an idea of what else is available. So when you're able to get that support system in place, then you can have some time for yourself and have the important self-care. And yes, if you as a caregiver feel guilty at all, please know that in taking care of yourself, you're going to be able to better take care of your care partner, right? And in learning how to provide self-care for yourself, just like you're planning for your care partner, you have to plan for that self-care for yourself. Start small, just like we do with the care partner. Start with little pieces, maybe 15 minutes, 4 times a week. If you succeed in that, maybe you can go to half an hour, 4 times a week. But you do have to make a plan for your self-care in order to be consistent. And then we guarantee that when you do that for yourself, then you're going to be able to be rejuvenated and be able to function well in your journey.
Yes, that might be the most important point we really want to drive home with our audience today is take care of yourself.
Please
do. Yes,
that
is our plea to all of you. And kind of moving into that. So, self-care, so important. And we recognize that there's all levels of caregiving, right? The audience that's watching this, there's going to be different stages. Some of you may not be a caregiver yet. Most people will at some point be a caregiver. Maybe you're not there currently. Some of you are in the early stages of caregiving. Some may be in that stage where they're going to be transitioning their care partner to a facility. And some of you have lost your care partner. And along with the grief, I know there's also sometimes that loss of identity. I'm a caregiver, that's who I am. And then all of a sudden, I'm not a caregiver because that person is no longer under my care.
Right.
Can you walk us through that experience? And again, with all of your years of experience working with people, what kind of words of comfort and hope can we extend to those people that are on that recent journey of, I'm no longer a caregiver?
Yes, so we all know that there's transitions in life, and even more so with the journey of caregiving. So if you as a caregiver are experiencing that transition, also if it's getting to that late stage, and if you're a person who actually have your care partner being lost due to that disorder, emotions will run up and down. We know that. And that's why referring to the support system that you have in place, you need to be able to talk about those emotions. You need a support system for yourself in that journey and through that loss, if that is what has happened for you. If you can have at least one or a couple of people that you trust, that you can share with, then you're lessening that burden on yourself, and then you'll be able to perhaps gain your identity even more so back because you'll have people to support you.
Yes, and I think, going along with that, it's an important opportunity. We know this, but to remind our audience that under the Older Americans Act, Title 3B, one of the supportive services that is funded is mental health counseling. So that's one of the services that you can get connected to through our helpline. That number is 1-800-963-5337. That number is going to be showing up on your screen, and keep it. Right? You may need it at some point. So we've talked a lot about resources, and we're not going to spend a lot of time talking about it because the audience is able to see that. So in the show notes to this episode, you're going to see a list of a lot of resources. Terri was kind enough to supply me with things that I didn't know existed, so I appreciate that. So at any point during this episode and you see something on your screen, feel free to pause it, write that information down. The bottom line is you are not alone.
That's right.
And we want you to believe that and to hear that. As we kind of wrap up today's episode, I want to leave with some advice for our current caregivers, specifically those who are kind of in the early stages, right? Mm-hmm. This may be very recent. There is no defined journey that caregiving looks like. We don't know time frames. We don't know how disease will progress. All of this is very individual. For those who are kind of starting out on the journey, what tips can you give them to move forward with?
Absolutely. Please don't feel like when you're presented with an opportunity that you don't need it, an opportunity to have help. Early in the journey, you may feel like I'm doing just fine. I don't need any help. and we're contented in what we're doing. But things change. And like you said, Regina, we don't know when things are going to change. So having this plan in advance, being able to investigate resources, being able to talk to people, being able to actually make that phone call and just get an idea. Preparation is everything. I will tell you, when I talk to people about the Savvy Caregiver program, there's 3 responses. Number 1, thank you, no thank you, we're just doing fine. There's also, I'm sorry, I don't have time, I don't have the resources I had before, and I am now the only caregiver. And then the last thing is, oh, thank you so much for telling me about the program. I wish I would have known about it before, earlier. So please, we implore you, check out your resources. There are plenty of available, and I'll give you just a quick story. I saw this firsthand. My neighbor, Norma, her husband had a dementia-related disorder, and I saw the process. As it got to be a little bit more, she, at the very beginning, early onset, she simply just kind of protected her husband from everything. As it got worse, she was still doing the same thing. That's what she knew to do. She was the sole caregiver. She felt like she could handle it. I couldn't even talk to my own neighbor because she would whisk him in and out of the house. And he could have used that engagement. Thankfully, she learned she was getting depleted. She got some help, and it made a big difference to her before the end of the journey. So yes, please, even if you're early in the journey, even if you feel you're doing okay, get your resources together, get your plan of action, get your family involved, the ones that are supportive.
Right.
And that way you'll have more success for the journey.
I love that, and I kind of wanted to chuckle earlier, like I don't have the time.
Right.
We need to learn to make the time. That's kind
right.
of part of the preparation, and realizing that, what was normal, this is a new normal.
Right.
And new normal might happen multiple times throughout that journey. So I think as we kind of wrap today up, and I appreciate so much your time, grace is the word that's coming up for me. Giving ourselves grace.
Yes.
Giving grace to our care partner.
Yes, absolutely.
Well, Terri, thank you so much for joining us today. Having you and Jane on to have this conversation was just delightful. I just have so much admiration for the work that you do, and just excited that we can bring this information to everybody.
Thank you, Regina, and I'm glad that we could be here, and we hope that these tips and resources help you.
Absolutely, absolutely. So if you are a caregiver who wants to do better than just managing a situation, please contact us. If you know someone who is a caregiver and would benefit from taking the Savvy Caregiver course or other resources available through our helpline, please connect with us through the information you see on your screen. You can visit our website at agingcarefl.org and look under the tab Caregiver Support to find out about upcoming classes, or you can call 727-570-9696 extension 160. If you have taken the Savvy Caregiver class, please share your experience with friends, family, doctors, members of your faith community, anywhere you can, so we can continue to support caregivers on their journey. No one should feel alone when there's a community around you ready to help. I also want to remind all of you that the Area Agency on Aging of Pasco, Pinellas County helps connect seniors, caregivers, and adults with disabilities to a variety of programs and services. The starting point is to call our helpline at 1-800-963-5337. Our incredible staff can connect you with resources like mental health counseling, respite care options, evidence-based programs such as Savvy Caregiver, transportation, home-delivered meals, home care, incontinence products, legal services, and so much more. Many of the programs do have wait lists as well as eligibility requirements, but even if you don't qualify for financial assistance with these resources, we can connect you to vetted and reputable organizations that could be part of your plan moving forward. We hope you learned a great deal from this month's broadcast and that you will join us for future episodes. Thank you for tuning in, and we'll see you next month with another installment of Aging on the Suncoast.